Many Americans will live with mental illness at some point in their lives. The National Alliance of Mental Illness projects that about 1 in 5 Americans will experience mental illness. However, access to care still remains a barrier for many. According to the National Council on Behavioral Health, 77% of counties in the United States are experiencing a severe shortage in mental health providers. This means that many individuals living with mental health conditions do not get care. According to the National Institute of Mental Health, only about 44% of adults with a mental illness will actually get care. Many are seeing digital health as a way to expand mental health access and make clinicians' time more efficient.
It's interesting. Pre-COVID, many technologies were operating at the periphery of conventional care. These technologies like digital cognitive behavioral therapy or even telehealth services, these were considered to be really edgy, right? But what COVID has done is it's pushed these technologies into the mainstream. And these are here to stay, thankfully, because they're having an impact, at least based on early data. For example, telehealth utilization has skyrocketed during the pandemic by as much as some ridiculous number, like 3,500%, right? And half of the claims for telehealth services are for mental health services in particular.
Rates of anxiety and depression have skyrocketed during the COVID-19 pandemic. A Kaiser Family Foundation report found that 4 in 10 adults in the U.S. have reported anxiety or depressive disorder symptoms during the pandemic. That is up from 1 in 10 adults the year before.
It's the pandemic. Like we've got to a point now as a result of the pandemic where mental health is really front and center of everyone's conversations, and it's although it's not really how anyone would have wanted it to happen. I think the silver lining of the pandemic is that this problem that's always been there is impossible to ignore now.
Today we are seeing an uptick in interest in the mental health space in payers and employers who are more often turning to digital options.
People are stressed out, they're more depressed than they've ever been, people are experiencing more anxiety than they ever have, and we're seeing a huge demand and a huge need for more mental health and behavioral health services and providers. We're getting a lot of incoming from payers and employers who are saying, we need to do this better than we ever have because people are so impacted by this. They're anxious from the isolation, but they're also anxious and trying to figure out what does life look like on the other side as we come back together. And employers are starting to recognize they've got a real role to play and responsibility in addressing these issues, because if they don't step up, no one else will. And they're seeing that when it comes to retention. It's a real part of retaining the talent they want and attracting the talent they want.
As more and more apps and other technologies come onto the market, we are also seeing a divide between mental health care and mental health wellness, such as meditation.
Yeah, so I think that, again, this comes down to the division between what we might think of as wellness and true healthcare, and it doesn't matter whether it's digital, human, medication, like whatever the modality. If you're focused on solving a healthcare problem, you need peer-reviewed, like gold standard clinical evidence of safety and effectiveness. Like that is, it doesn't matter what form that takes.
Today, mental health costs are staggering. According to an Open Minds report, the mental health market was worth $225 billion in 2019.
In my opinion, it's really important that we do everything we can to make behavioral health treatment services more accessible and affordable to those who need it, right? And this starts with, number one, continued investment in reducing stigma associated with seeking behavioral health care. Number two, investment in crisis services, right? And specifically the necessary digital infrastructure to help people actually access care once they call into a crisis line. And then number three, continued focus on loosening laws for care delivered remotely.
Today, patients are sitting in the driver's seat of care. With everything from traveling to banking done conveniently from home, patients are also beginning to expect more out of healthcare.
Very positively, there's all these new digital applications out there. There's new digital providers out there that are really helping address this problem. So what they want and what they need is ease of access. How can I do it when I need to engage in a really simple way that matches my lifestyle, that's easy for me when I need it? And they're used to accessing everything in their life that way, yet the healthcare system is still pretty complicated. So consumers are more likely to engage if it's easy for them to engage.
Telehealth is also able to help patients overcome traditional challenges in seeking care, like transportation.
Providers that we work with on the ground, that treatment delivered by telehealth is helping their clients, their patients actually stay in treatment, in complete treatment. And that's because they don't have to worry about transportation, right? Or childcare. And they can tap into group sessions at any time. So again, early anecdotal data suggests that telehealth, behavioral healthcare services delivered remotely via telehealth, that it's effective. And we'll see, that what the data demonstrates over time.
With more and more digital health tools on the market, clinical validation is becoming more and more crucial.
I think that any digital mental health or just digital health intervention versus, say, a digital wellness intervention has to just, there's no two ways about it. You've got to do the work to demonstrate against the highest standards of clinical validation the safety and effectiveness of what you're doing.
This is Laura Levitt for HIMSS TV Deep Dive. Please check out more of our content at hims.tv. And thanks for watching.